My name is Bailey. I am from Encompass Health Rehabilitation Hospital. I am an occupational therapy practitioner. I'm going to be giving you a presentation on fall safety. Chris, do you want to start and just introduce everything a little?
Hi, everybody.
Hi.
So, thanks for joining us. Just real general, if you're not familiar with inpatient rehab is where folks go to recover from a new or chronic illness that they have, and we specialize in getting people home they go from the hospital to our hospital, and then we discharge them home. That's the goal. We service a lot of patients that have stroke, recovering from stroke, brain injury, multi-trauma like car accidents, hip fractures, all of that. But one of the things that the differentiators for us in the inpatient rehab space is that it is a hospital. So it's similar. It doesn't have all the equipment that the acute hospitals have, but it's a hospital level of care. So there's physician oversight 7 days a week, and lots of nurses, lots of CNAs, respiratory therapy. We do wound care. It's a full plethora of services. So again, our goal is to get people back home, and we're held accountable to get over 80% of the folks that come to our hospital back home. And the average length of stay is about 12 days. So it's a pretty short stay in the inpatient rehab space. So that's just a general overview of the population we serve, average length of stay, and some of the conditions we treat. Bailey will get into some more specifics. And again, we're just going to be generalized talking about inpatient rehab space. And then afterwards, we'll open it up for questions. Thank you all for coming. I really appreciate it.
If at any point in time you have any trouble hearing me, please let me know so I can repeat myself or raise my voice a little. So a little bit about me. Again, my name is Bailey. I'm a certified occupational therapy assistant. I have 6 years of experience in outpatient clinic settings, inpatient rehabilitation, skilled nursing facilities, and working with kids. Inpatient rehabilitation is my favorite. I love working with people to get them back home. So the objectives of today's presentation, we're going to be going over fall facts, what makes people more likely to fall, what you can do to prevent falls, and what inpatient rehab can offer individuals. So some fall facts in the U.S. Falls are the leading reason for ER visits. Falls can cause broken bones, head injuries, and overall possibly lead to a loss of independence. So over 300,000 patients are hospitalized with hip fractures, and more than 95% of hip fractures are caused by falls. Some more facts, about 1 out of 4 older people fall each year, and 1 out of 5 falls causes serious injuries such as broken bones or a head injury. And over 800,000 people are hospitalized a year due to fall injury. Falls are the most common cause of traumatic brain injuries, and and falls cost the U.S. about $50 billion a year in medical expenses. Next, I want to talk about the intrinsic factors or personal factors that can relate to falls. Muscle weakness, balance issues, vision problems, cardiovascular issues such as blood pressure, dropping or getting too high heart rate, and coordination problems such as your vision and motor reaction times. Medications also have a significant effect on falls. So medications such as sedatives, antidepressants, opioids, and pain medications. These are medications that can cause fatigue, sleepiness, or dizziness. And also alcohol can also cause those symptoms and increase your risk of falls. Lastly, changes to your medications. There is an increased risk of falls with those. So making sure if you do have a change in medications, you're really monitoring how you feel, and you let your doctor know if you're experiencing any of that sleepiness, dizziness, or fatigue that's keeping you from being safe to do the things you need to do. And pain is another big factor. Pain can make you need medications, which can affect your safety and mobility, and pain can cause you not to move as much, which in turn makes you weak. And depression. With depression, sometimes people don't eat as much or have a significant decrease in their activity level. These factors both contribute to increasing the risk of a fall. And again, medications will produce some side effects as well, as we talked about before. The dizziness, the sleepiness, the lightheadedness, all things to watch out for. Next, we're going to go into the extrinsic factors or the environmental factors that can contribute to a fall. So environmental factors can include lighting, accessibility, pets, pathways, equipment malfunction, improper footwear, and weather. So how can you prepare your home for safety? Lighting. We want to make sure you have adequate lighting around all areas of your home, in daytime and nighttime. So as therapists, we recommend night lights to your bathrooms, night lights along the flooring, lighting in closets or on stairs, and wearing glasses if you need to. You always want to make sure that you can see where you're going, you can see any trip hazards, that you know where your end destination is and you can get there safely. Equipment malfunction can be things like walker brakes, they get loose over time, or wheelchair brakes, making sure you get those modified and tightened as needed. You can take if anybody has a four-wheeled walker, has seen one of those where they have the brakes that you push down, those brakes can get loose over time, so you can take them to bike shops and they're able to fix those for you. And if you have a lift chair or any equipment that runs off of battery, doing checks on that frequently to make sure that the battery is charged if you need that, make sure all of the cords are good, that the equipment's going to work when you need it. Pathways are a big cause of falls. Clutter in there, rugs, throw rugs that your foot can catch on are a common cause of falling. So make sure that you have clutter out of your pathways, you have things off the floor. We recommend removing throw rugs, making sure you don't have any cords in your pathways. And pets. So pets like to get in front of our feet, like to be in our way, right? So make sure you're looking out for your pets. Think about keeping your food dishes out of your way, because that's something you can trip on. The water, if they make a mess drinking the water, that creates a slip hazard. So by keeping their food dishes out of your pathway, helps decrease the risk of falls. Cats, sometimes bending down to clean out the litter box can cause a little loss of balance. So a good idea is raising the litter box off the floor, or even the food off the floor if able. A little side table is sometimes nice, or I've even had people use a tote with a lid before, just to raise it off the ground and give you good space so you don't have to bend down as far. Yes?
You can buy long handled litter scoops.
Yes, you can. Those are very handy.
Yes.
I appreciate that thought. Yes, you can scoop your litter standing with those. They're very nice. And improper footwear. So, we always recommend shoes that have a nice sturdy heel. Sandals, Crocs, or something without that heel support can really lead to tripping. If you're walking around your home, make sure you either have some sort of shoe on if you're walking on linoleum, laminate, hardwood floors, or make socks that have some grippy texture on the bottom that you can order off Amazon, Walmart, and those also prevent you from slipping. There are also some fancy shower shoes they now sell out there if you're ever afraid of, in that instance. Has just a little mesh on the bottom, or mesh around your foot and some rubber on the bottom that helps keep your foot stable, helps give you some nice grip in the shower and the bath. So here's an example of a raised feeder for your pet. All right, grab bars and rails. grab bars around the bathroom, around the toilet. They also make things called a toilet safety frame, which I'll show you in just a second. Shower chairs or benches, something to sit on while you're bathing, helps keep your safety and your balance so you're not bending over, lifting up one foot to wash that. Or if you get dizzy or lightheaded, sometimes with the hot water, you've got something to sit on and stay safe. Handheld shower head are the shower heads you can remove from the wall. That way, as you're sitting, you can really get your hair rinsed out, get your back rinsed, rinse your legs and feet, and you're not sitting there with the water spraying at you the whole time you're showering. And a reacher, and doorway swing clear hinges to widen doors. So this right here is a toilet safety frame. It goes behind a toilet. It's kind of like a walker. What it does is it gives you the ability, as you're sitting down, to be able to brace yourself on the handles. And when you're standing up, you've got something to push off of to make sure you're safe and keep your balance. This right here is a reacher or a grabber. So these can be used for a multitude of things, picking up things off the floor, picking up things off of a high counter. They can be used as a dressing tool to help put on pants. They are one of my favorite tools in occupational therapy. I think everybody should have a reacher. And here are just some examples of some grab bars. So you can put grab bars vertically, you can do them at an angle, horizontally, whatever really works for your setup and your needs. Now that we know all of the things that can cause falls, what can we do to prevent falls? Exercise. Exercise, exercise. And I see you've got some weights here, and you probably have some great exercise classes that they offer here. So, some good exercises you can do at home without any equipment. Leg exercises. So, sit to stands. And that's just as it sounds. Just working on sitting down and standing up a couple of times. It's a great exercise for the legs. It's great for the stability. It works a lot of those muscles that we need for the balance and standing. So just do this 5 times and you'll feel it. It's a great exercise to do before you get up and get moving. Marching. Just sitting here and marching. Works your core, works the legs, can get a good exercise in. I say for about a minute at a time, and this is a great thing to do while you're watching TV and the commercials come on. Just do some marching. Swinging legs out to the side or backwards. So this is really good to do, let's say at a sink counter if you're able to hold on to something, or even the back of a chair. You can swing those legs out to the side. You can go back. You can stand sideways and go forward and back. This works on the balance, but I always recommend holding on to something stable like a sink counter, your kitchen counter, something that will help provide that stability for you. And then working on your static balance. Static balance means you are staying nice and still. You're not doing a whole bunch of reaching, but the balance as you're staying nice and still. So start with your balance with support, again with a counter, with something, and just maybe try to stand up for a minute or two, maybe watch the cars as they go by, look out for a couple birds, something you enjoy, and then you can increase it and work on it without support. You can make it a little easier by starting with your feet apart. You can make it a little harder by moving your feet closer together, or moving 1 foot forward and 1 foot back. Those are ways to increase the balance, challenge, and help increase your stability. At the bottom there too it says eyes open and eyes closed. Don't close your eyes and work on your balance unless somebody else is around you. Sometimes that can really throw off the balance. Dynamic balance is balance with movements. So things such as sidestepping, right? You can still use that counter and just take some steps with it. You can do some backwards walking. Again, hold on to that counter and just try to take a couple steps backwards. Tandem forward and backwards walking or figure eights. anything that really challenges your weight shifting between your legs and your reaching. A great way I like to do this is standing at a table and maybe set out some cards or some towels if you like, if you need to do some laundry, and really work on maybe stepping over here to fold this, step over here, reach and fold that. It's a great way to get your housework done on top of exercising and keeping yourself getting stronger and more balanced.
Could you show me a figure 8 walk?
So that's going to be where we kind of walk in a circle to our right. We'll go back, we'll walk in a circle to our left.
Thank you.
You're welcome. So some other great ways you can work on your balance. Tai Chi originated in China as a martial art type of exercise, but it is great for posture, strength, flexibility, aerobic conditioning, and balance. It also improves cardiovascular fitness, lowers blood pressure, prevents falls, and decreases in arthritic pain. When I was a student, my professor was a Tai Chi instructor, and she made all of us practice Tai Chi occasionally throughout our semester, and just doing it once a week, my balance improved immensely. So it's definitely something I recommend. It's great for people of all ages. You can do the exercises sitting. Once you're able to do them standing, they'll upgrade it to that. There is some Tai Chi in the area around here as well, some Tai Chi facilities that offer that. Other options, ask your doctor or your pharmacy to review medications. Ask for your doctor to evaluate your risk for falls. There's different evaluations or tests they can do, such as having you sit down and stand up as many times as you can in a minute. There's some different areas. If you score below a certain number, that kind of tells them that you're at an increased risk of falls. There's another one where they have you lean up on a wall and reach forward, and depending on how far forward you can reach while maintaining your balance, that also tells them if you're at an increased risk for falls or not. So great thing to ask your doctor about that and see if they can do those assessments with you. It doesn't take any more than 2 minutes to complete those. Have your eyes checked. A yearly eye exam is very important. Especially as we get older, our eyes change that much quicker. Our acuity, or how clear we see things, changes really quickly. So making sure you're getting those yearly eye exams to make sure you are seeing everything as clear to keep yourself safe. And safe transfers methods. Use your hands for your sit to stands. By that, I mean, as you are sitting down somewhere, it's always good to back up to the surface until you feel that surface on the back of your legs, whether it's a chair, the toilet, or your bed. And then reaching with one arm, or two if you can, for the handles, for the bed, or something, so you know it's there, it's stable, and you can lower yourself down onto that surface. With your hand reaching, it tells your body where that is. So it helps prevent you from doing that thing, that flop that we sometimes do. So again, reach back with your hands, and then you can lower yourself safely down to a seat. And again, for standing up, we don't recommend reaching up for the walker. We recommend pushing up from the surface you're sitting on. You can scoot forward, push up from the chair or the handles if you have some sort of handle or grab bar around you, and push up from there to stand, and then once you feel nice and stable, move your hands onto the walker. Does anybody have any questions about that? Okay. Spend 10 to 15 seconds in each position. There are times if we move positions too quick, our head starts spinning, and that can really cause an increase in falls. So spend 15 seconds when you go from laying to sitting up at the side of your bed before you try to stand up and start walking away. Spend that 15 seconds there just getting everything settled, make sure you feel good. Stand up, and again, give yourself 10 to 15 seconds before you just race off to the bathroom or wherever you need to go. It's good to make sure you're fully awake, that your body's ready to go, and that all of your systems are in line and ready. And have an appropriate device with you, whether that's a walker, if you use a walker, cane, grab bars, whatever you need for safe mobility, we want to make sure that you have that set up. A lot of the times, people maybe leave a walker and take a couple steps to get where they need to be. We always want you to have it with you, because if you stand up and you're feeling a little bit dizzy or you don't have good balance, there's a couple steps away to get to the walker, and that right there is a good, or an area that you could fall. So always make sure that you bring your devices with you so that we're way there within reach.
4WWFWW.
So a four-wheeled walker or a front-wheeled walker. The
Okay.
four-wheeled walkers are the ones that have the four wheels. They generally have a seat on them. And then the front-wheeled walker is just kind of a standard walker. They fold up, they've got the two wheels on the front, and the solid pieces on the back. Sometimes people put tennis balls over the back just to let it slide a little easier. But yeah, that's the difference between those. They're fancy names. So unfortunately, sometimes falls do happen despite of our efforts. Always keep a phone with you or consider a medical alert system such as a Life Alert, Lifeline, Medical Guardian. Some insurances will cover the life alerts. Other options are your phone with you. Smartwatches that connect to your phone will actually notify your emergency contacts if you have a fall. Also things like Alexa or the Google Home, if you have those connected to your phone, you can say, Alexa, call 911, and they will do that. So having those systems set up are really great, especially in areas that have a higher chance of falls, like bathrooms. I always recommend people to bring the phone at least in the bathroom with you, not into the shower, but if you were to slip and fall, have something within reach that you can call for help. If you have fallen, did you hit your head? If you did hit your head, or believe you may have hit your head, you need to seek medical treatment immediately. Hitting your head can cause brain bleeds, can cause injuries that, if not treated right away, can intensify or get worse. So if you do hit your head, or if you think you've hit your head, you need to seek medical treatment immediately just to make sure they can check you out. All right, so I'm going to talk just generally about inpatient rehabs. I've worked for a couple different inpatient rehabs, and they have some commonalities across the board. So inpatient rehabs generally have this large gym system here with a lot of high-tech equipment. So we've got devices that work on your stability, harness systems that can work on your balance and walking, a ton of exercise tools. I'll just point out a couple here. This one here is called a vector system. It can be hooked up to a full body harness to work on walking, balance, walking backwards. What it does is, if your knees buckle and let's say you start to go down, it will only let you go down 3 or 4 inches before it stops. Lets you push back up so you can really increase your confidence with whatever you may be needing to do. In the past, I've used this with somebody who really wanted to get back to golf and to that big golf swing. And to practice that, they were able to be in that system and really get their balance down with what they needed to do so they could get back to golf. We've had somebody else that really liked Zumba classes, so we hooked them up to that, and they were doing the grapevine for us and teaching us a Zumba class. It was great. So it can be used for a lot of different things. Another device we have in the back here, it's called a BITS system, but it really works on balance with integrating vision and technology. So it can work on your vestibular system and your balance, your coordination all at the same time. It's a great device. So many fun things we can do, and it's almost like we're playing a game when we're on that. There's a lot of other equipment here that's all really fun, and that all has their own benefits to use. We have cars that we practice getting in and out of to make sure you're safe to get in and out of cars, or we can teach you different ways. At one inpatient rehab facility I worked at, they had an actual car in there that you would get in and out of. This one here is a pretend car, but we can crank it up and raise it to the height of whatever vehicle you might be needing to get in or out of. We have treadmills with walking devices. This was the balance device I was talking about before. Got all sorts of different stuff there. At inpatient rehabs, they also have apartment-like suites that you can practice all of the things you need to do at home. So we've got a kitchen, a bed, laundry. We'll have you practice in inpatient rehab. We have people practice making a meal, practice doing their laundry, practice getting in and out of a tub or a shower with different equipment. So that way when you go home, you are confident and comfortable with what you need to do with any recommendations to increase your safety. Earlier before, I talked about a shower chair or tub transfer bench, which are nice devices to sit on. This right here is a tub transfer bench. It sits inside of the tub and a little bit outside of the tub. This allows you to sit on this end, and as you're sitting, you can lift your legs into the tub and then slide in, so you don't have to step over that tub to get in and out of that. It really, really increases the safety with tubs. They also make things like that for walk-in showers that are just a little more narrow and a great seat to sit on. They have ones with armrests, ones with backrests, ones that are just a little stool. So there's a lot of different options out there for safety in bathrooms. One more thing I want to touch on in here. Other safe options for the bathrooms: grab bars, a non-slip mat in your shower, or the non-slip adhesive stickers. You can place those down in your tub, and it just gives you a rough texture for under your feet, so you don't slip in there when it gets all wet and soapy. They sell those on Amazon for anywhere between $10 and $15, and it has a lot in one pack. So they're very useful. Does anybody have any questions? All right.
Are these pictures from Encompass?
This is from Encompass, but I've worked at a couple different inpatient rehabs, and they're all similar with what they have to offer as far as the large gym space, the apartment-like suite. The rooms are nice and spaced.
Can a person who has a hip replacement go there afterwards?
Yes.
I mean, is that part, does Medicare, do you know if Medicare takes care of that at all?
I might relate this to Chris,
Yeah.
if that's okay.
So Medicare does fully cover a stay. So we have certain criteria that people have to meet, and once that's determined, yes, I mean, we would accept Medicare that are going to cover the full service, yeah. But there are criteria that are specific to meeting our level of care, because we do staff with physicians on site. You have to have a medical need for that amount of oversight. You have to be willing and able to participate in the amount of therapy that we provide in the space. So there are some conditions. But yeah, that's.
Do you have to stay in the hospital a certain amount of time? You know, sometimes you have to stay 3 days before they'll let you.
Yeah, so the average, everyone comes at a different functional level to our hospital. So it's determined, it's reassessed every week. So we do an initial assessment when patients come to our hospital to determine a best guess of how much time they will need, but it's not clear cut. Again, the average length of stay is 12 days in our place, but there's outliers, right? There's people that need more care, and insurance, when they approve, they can stay longer. Some people don't need as much as 12 days.
Thank you.
Yeah, but everyone's got an individual care plan. Great questions. What else?
I will touch a little bit on the intensity of therapy in inpatient rehab settings. So in inpatient rehab settings, you get therapy 3 hours a day, 5 days a week, or a total of 900 minutes a week. So it's a pretty intensive therapy time, but it's really great to get you safe, stronger, more balanced, because it's so intensive. We do some group therapy sessions where you might be working on an exercise group with others, but most of the therapy is on an individual basis.
And some of that 3 hours, so it's not, we did show you a picture of a treadmill, but it's not like 3 hours on a treadmill.
No.
Right? So everyone comes at a different functional level. So some of that 3 hours that's required on a daily basis or 5 days a week is education at the bedside. Sometimes people start their therapy in the room, so it's education on ADLs and brushing your teeth and putting your socks on and all that stuff. It's not, it's intense in the sense that it's a commitment. You're going to participate in 3 hours, but it's not all high intensity workout. And it looks different for everyone because everyone's got different diagnoses and different functional levels. So does that answer your question?
We have definitely taken people after a hip replacement. We work on introducing different adaptive equipment or tools to get dressed as that hip is sore and healing, or different ways to go up and down the stairs, or safe ways to keep you balanced as you're cooking and doing all of those different things. So, inpatient rehab, I would recommend to anybody that needs it.
Yeah.
Any other questions?
Well, what about walking on sidewalks? Because I took quite a tumble about a month ago, because I was, looking up and I didn't notice unevenness. And so I started to fall forward, but I had like 1 or 2 seconds to think as I'm going forward. So I was afraid I was gonna break something in my hand, but that's what I did. I put my hands out there. Fortunately, I didn't break anything, but I had some bad bruises on my knees and elbows. Is there any way, if you have that 1 second to think, how should you put your hands when you're gonna fall to break the fall?
Unfortunately, that is a great question for physical therapy,
Oh.
but that is something that physical therapy does work on in inpatient rehab. They work on walking on flat surfaces, work on walking on uneven surfaces with devices, and they work on, if you were to have a fall, how to react to that and how to get yourself up from that fall if you are safe and okay to do that. So I'm sorry, I don't have the answer to that.
I will tag on to that in the inpatient rehab hospital world, we have these controlled environments that we've shared with you, like the gym and such, but we also, in general, inpatient rehabs have an outdoor area as well, and we have a courtyard, we're no different, which incorporates different surfaces. So to your point, we have cobblestone and different grass and all those different, if you're looking up in the air and you're not paying attention to the surface, you can actually practice it in the inpatient rehab world, so it's really transferable when you get out into the real world.
Do you need then like a doctor's recommendation or okay to use this facility?
So we need a referral.
Referral.
Yep, and then from that point, we have a team that evaluates every single referral, and then we have to run it by our medical director, who oversees the care in our hospital, and he would have to determine that there's a need for our level of care, which is a higher level of care, that there would be a benefit from participating, and that there is a need for an interdisciplinary approach, like multiple disciplines like PT, OT, speech, maybe respiratory therapy, other chronic condition management. So it all starts with the referral, yes, and then we go into the next step of evaluating candidacy for our level of care, and then we would manage, obviously, the payer aspect to make sure that there's no surprise billing, and you would know ahead of time if there's what kind of coverage there is and all of that.
Does Medicare, do you get paid by Medicare in some cases?
Medicare, yeah, we service many Medicare patients. Yep. Medicare is really good about covering. They believe in general, the inpatient rehab hospitals are Medicare strongly supports them and is approves very well. Great questions.
I do have some handouts that kind of run through different areas of your home and just some different tips or areas to check on to see if there's anything you could change to make your house a little safer, to make your living area a little safer, and decrease the risk of falls. So I'll pass these out, and if you have any questions, I would be happy to go over these for you.
Thanks for going.
Thank you.
And then if you're interested, there's just a general